Hi, this is Joe Zaza with ASD Management, and we're going to do our final video today on the management of surgery centers. In the previous videos, we've talked about the history of surgery centers. We've talked about pre-development and setting these things up. That there's generally successes or failures before they're built, that cash is king. You got to have plenty of working capital when you open up a center. The steps required to develop a center, the steps required to create what we call the house, the four cornerstones of your operating systems, and then the roof is your leadership, and the walls are the people, because healthcare is a people business. And we're going to, we have our surgeons, staff, anesthesia, and administrators as your walls. And so we've built our house around our systems, our people, and our leadership. But now we've got a center that's up and running. It's got its managed care contracts, it's licensed, it's accredited. Now we've got to run the thing, we've got to manage it. And what is the difference between a well-run surgery center and one that's not well-run? Well, over the last 30 years, we've seen centers in both areas. And one of the things that is important from a leadership standpoint is establishing a vision for the surgery center and a standard. And it's how we're going to do patient care, and it's attracting the right people to the center. The staff is the key to running these things. Getting the right staff, which then begets surgeons wanting to come over there and making it easy for them, and then patients like it better, and their families like it better, and everything starts rolling downhill. So communicating the vision to the staff, and then as managers, we have to support the staff. Hollywood does a very poor job of explaining business management. It looks like some guy sitting up in an ivory tower on a cell phone or doing deals in a plane. It's not really like that. At least my experience is not that way, okay? It's really about clearing the road for your people to let them do their job, and being a support for them and trying to keep them moving towards the correct goal. And to me, that's what leadership is. And it's very important that as the venture comes together, the hospital and the surgeons, if it's going to be a hospital physician joint venture, which are the more complex ones, that they work together. They don't have to agree all the time on things, but they work well together, and that management has a clear vision and it's conveyed to the people, and that your administrator and your staff recognize that, and then they buy into that vision. People skills are extraordinarily important. What are people skills? Well, there's books written about people skills. I think it's about listening to others, understanding their motivations, and then putting them in the right position so they can shine. We look for people with character. We look for competent people. We look for people, that managers with a serving heart. And those are the things we all want when we hire our administrators at our surgery centers, our business managers, because you can tell the difference between a center that operates really well, may have the same kind of systems in place, but if they don't have the right managers in place, you're going to have a problem. Running board meetings, I want to just touch on this point. Board meetings at surgery centers really should not go over an hour. Yes, I have some that go an hour and a half or an hour and 15 minutes, but they don't go past that. We know that you surgeons can only grasp 2 or 3 key concepts, maybe 2 concepts you're going to take out of a meeting because you're tired, you've been doing cases all day, this is not what you do all the time. The same thing with the hospital administrators. Y'all have got 1,500 things coming at you. So every board meeting, you're going to get 1 or 2 key concepts across. Focus on those 2 or 3 concepts that you really need to emphasize with your board members, and try to keep your meetings short, okay? You can circulate minutes ahead of time. You can annotate your agenda ahead of time. That way, you can focus on the things while you still have their attention. So what are some key things managing surgery centers? Well, let's start with the financials. Typically, those are done, they should be done on an accrual basis, not on a cash basis. And that will measure, or attempt to measure, how you're doing that month, matching up revenues and your expenses for that month. Benchmark information is the thing we'd like to emphasize. It's really important once the center matures to see how it benchmarks with other centers. The ASC, ASCA Association has really good benchmarks. These are also published through Becker's Value Management Group has a telemarketer survey. We have, we've had over 100 centers, so we have our own benchmarks, but we also look at the other ones too. And we're trying to see how does this center run compared to its peers based on what kind of center it is. A pediatric surgery center that does a lot of tubes and tonsils is going to be very different than a center that does musculoskeletal total joints. So you've got to understand the differences between the two types of centers, but we're going to use benchmarks to see how we're doing. Some of the key benchmarks are going to be this: revenue per patient, supply cost per patient, staffing hours worked per patient, staffing cost as a percentage of revenue, supply cost as a percentage of revenue, and AR days. Let me touch on AR days. That's how long it takes you on average from the time you do a case to the time you collect money. It should be 45 days or less. Unfortunately, people can play with the formula to make it look a lot better than it is. But as long as you have a very strict write-off policy, meaning that you have to exercise pretty much everything over a long period of time before you write anything off, then you should have a clear picture of AR days. That is the barometer of your business office. How many days it takes to collect revenue from the time the patient is done. Now, in order to do that, you must load your payer contracts into your IT system, and that includes your Medicare rates, so that if you do a case and you're charging $10,000 for the case, but you're only going to get paid $3,000, it's going to write off the $7,000 or take a contractual discount, it's a better word, at the time of billing. So it says that your AR is $3,000 and the patient may owe $600 of it. You've got to try to collect that up front, by the way. And then the insurance company owes you $2,400. Focusing on those AR management systems, this is one of your key foundational things we talked about earlier, which is your revenue cycle management, is extraordinarily important. But your business office is going to come down to compliance and AR days and paying your bills on time. So those are things that need to be, that's what management does. That's why people use third-party managers to make sure that those systems are working right. On the physician side, looking at utilization reports is important to see, oh, this doctor quit doing cases, and going to visit that physician saying, why are you not doing cases? And he or she may have a reason, for it. And you need to constantly look at your physician utilization. You need to look at your block times on a regular basis. Who's using their block times? The IT systems we have for surgery centers these days are excellent, and they give us a ton of data. Just learn how to, learn how to use the data to help you manage your center the best. Another thing is how to interpret reports and use them properly. You can look at utilization, you could look at AR days, you can look at your income statement, and you want to benchmark those things, but you also want to do trending too, which is we trend every center over a 12-month basis to see kind of, because there's a cyclical nature about patient surgery. So we're looking at every month to see what are the trends. What are the trends in collections? What are the trends in revenue? What are the trends in staffing? Because you're going to have anomalies. You may have a bunch of physicians out in July and you're going to get slammed in December. That's normal in our industry. But how to interpret that is extraordinarily important. So track things over a 12-month period, track things on a same-store basis, meaning this period versus the same period last year, and then use national benchmarks, regional benchmarks based on the type of center you have to effectively run your center. We don't run surgery centers, and you don't run surgery centers off spreadsheets, but they sure do tell you where to look, okay? So it's your great diagnostic tool. If you have any questions, please feel free to email me at www.asdmanagement.com. I've really enjoyed doing this series for you. Thank you very much.